hope people start coming in. And then I'm going to just share a slide to Facebook. Oh no, that's not what I want there. Go live.
Go live. Go live.
So it's just queuing up. Welcome everyone. Thank you for joining us. All right, so we are on Facebook. So I'll be checking the chat for any of our participants that are going to be on Facebook for we are deliberating the COVID-19 vaccine and hesitancy in the Black community, BMHA town hall. Thank you so much for joining us tonight. And we'll just give people a few more minutes to log in.
I think our next set of town halls, we're going to have waiting room music.
Yeah, so, you know, BMHA has its own theme music for its podcast, and it has two playlists of mindful music. So next time I will make sure that I have that queued up for us from Mindstream.
Yes.
So keep a lookout for us for the theme music for our podcast, Real Talk Black Minds Matter. Hopefully this summer we'll start rolling that out.
Yes.
And the important thing with that is we get all the donations from all the funding from that goes right directly to BMHA. So hello, Ida. Thank you for joining us. She sent us a little message in the chat. So I think we'll do one more minute. And we'll start with our Black Mental Health Alliance intro by Ms. Andrea Brown. Hello, Latasha. So let's see, who else do we have on here? Ida, Barbara, Benjamin, Latasha, Susan, welcome. And so guys, just a few housekeeping. For this platform, you can ask questions in the Q&A. You can also ask it in the Facebook comment section. I'll be checking that throughout tonight. We'll go for approximately an hour, depending on how much feedback you give us. So it's just like church. As many questions as you ask us is how much more you'll get out of us. So we look forward to this discussion. And we already have one question in the Q&A. So thank you, Ms. Ida. All right, so I guess, Ms. Andrea, do you want to start?
Yes, thank you so much for joining us. We know that you are Zoomed out, town halled out, COVID out, but we appreciate you today. You are really in for a treat. We have an amazing couple that will share with us, and Roxana will do introductions. And we've got almost our favorite doc hanging out with us again today, Dr. Weeks. And so I can't tell you enough about how excited we are to be able to host this. And we know that you've heard more than your share about COVID, but we don't want to miss the opportunity to have the conversation about hesitancy, about deliberation in the Black community. And so we're going to talk a little bit about that. And we really are going to get to the heart of the matter because we still are very much in a crisis. I had an earlier conversation with one of our board president who shared today about the vaccination among the Black community and how we really are at an interesting place. And so again, we'll talk about that. And then we're going to ask, I think Roxana has shared, please send us your questions. I think you'll find this real life story to be amazing. And I think you'll find some of the things that we just don't know as average citizens and what's at stake. And so again, we welcome you. And then last thing we talk about, you will hear us use the word instead of hesitancy, you'll hear us talk about deliberating, because we are trying to figure out if the vaccine is the right, is it the right thing for us to do? Don't get it twisted. We didn't get that on our own, right? We got that from somebody we know very, very dear, who reminded us that it is not just about we're being hesitant, but we are deliberating. Should we be in this place and in this space? So again, we'll talk about the truth about behaviors in the Black community, not just regarding the vaccine, but among a number of things. We learned something interesting today about the Tuskegee study, and I won't go into that, but I thought it was quite interesting. We'll talk about the dangers of both, being as you deliberate, and perhaps some dangers with the vaccine. We'll talk about what does equity, what does that really mean, and then more importantly, we'll talk about the heart of the matter and what happens when we put our faith to work as it relates to our loved ones being sick and ill. So again, I will turn that, I think, back over to Roxana, but we welcome you. We're looking forward to a robust discussion. Roxana is going to introduce our guests, and then we will move from there. Thank you.
Yeah, so I'm so excited tonight. I think Dr. Weeks is definitely one. We know so many different doctors. It's not good to say that, but definitely I just love her energy and just her passion for the community work that she's doing for us in Baltimore City. So I just wanted to have the presenters kind of, before they're speaking, go over what they're doing specifically. But we have Dr. Francesca Weeks, but we just call her Dr. Fran. From the Genevieve Strategy Group. She's a consultant right now for Baltimore City. And then we also have healthpreneurs, guys. Mr. T. Clark, Therian Clark, and Ms. Marcy Miles Clark. And the way that I came across their information, it was so inspirational to me that I just knew I had to help get their story out, and just a awesome positive story defying the COVID-19 experience. So these are two authors of The Praying Wife, Healed Husband, How We Survived a Death-Defying COVID-19 Experience. So I'm just gonna have them talk a little bit, intro themselves, and then we'll start our panel. So Dr. Weeks, do you want to start first? You can break the ice.
Great, all right. Well, good evening, everyone. I am glad to be here and be able to be with everyone. I'm excited about this discussion this evening. We have a robust discussion tonight, just talking about, what's happening in Baltimore City, what's happening across this country right now, and really how we've seen a lot of things transition over the past 15 months. Again, my name is Dr. Fran. People call me Fran. I am the owner of the Genevieve Strategy Group, which is a racial health equity consulting firm. And I actually run strategy for African-American communities across the country on programming and policy work for our African-American communities, which are mostly in our metropolitan areas. So for Baltimore City right now, I serve as their African-American and Black community strategist for COVID-19. So I'm going to stop right there and turn it over to the wonderful couple that I see to my right.
Hi, everybody. Thanks so much for having us. We're glad to be here. I am Marcy Miles Clark, AKA The Praying Wife.
And I'm Therian Clark, The Healed Husband.
Amen. And our titles kind of speak for themselves, but early last spring, we both contracted COVID mysteriously. We still don't know to this day how we contracted it. All we know is that, we got sick pretty quickly. I was pretty mild, fortunately. My husband, not so fortunately, went on to become deathly ill. Within a week's time, he had to have an emergency intubation at Johns Hopkins. And he, prior to that, was totally healthy. He's been athletic all his life through high school, college. And this was just really something that just came on really quickly and unexpected and really just changed our lives. As a result, he ended up in the hospital for 46 days, 28 days on the ventilator fighting for his life. And at that time, in a medically induced coma, I also might add. And during that time, he was coined Johns Hopkins sickest COVID patient because it was just so early on in the pandemic. There were no remdesivirs, of course, no vaccines. There were no monoclonal antibodies, as my bishop would say. It was just his body and God fighting it out. And we were in the background, me and my prayer warriors, just praying him, back on his feet. And so, you can't tell me that prayer doesn't work. Every time we prayed for him, he responded. And a month later, he would beat all odds and he would come out of that medically induced coma and be able to take his first breath on his own after a month. And after several months of restoration and rehab, he has made a recovery. And he is nothing but what we call at NBG, nothing but God, miraculous blessing. And so we are major vaccine advocates. We were first in line to get our vaccines. We didn't have an opportunity to get vaccinated. And so hence our story. Now we're on the other side of things. We'll do anything and everything possible to keep ourselves and anybody that we know and love and otherwise from going through what we went through. And so I'm just going to turn it over to my husband real quick because I can talk. And I'll let you just let him share, his few words, and then we'll come back throughout the hour as you guys have questions.
Thank you, honey. I just want to say we're huge advocates of the vaccine. I would not want anyone to go through what I went through. Thankfully, thank God, I was asleep during most of this. This COVID experience, especially being on the ventilator. As Marcy didn't allude earlier, I was so sick, they gave me a 15% chance of survival. And there were a couple of incidents back to back when I was on the ventilator that, at that time, they weren't allowing anyone to come in to see you. But because I was so sick, they really felt strongly that I wasn't going to make it through the night. One of my incidents, my body temperature hit 108 degrees. Another, that cytostorm syndrome.
Cytokine storm syndrome, which is a byproduct of COVID when you're really, really sick.
Yeah, so basically my brain was being fried. My oxygen levels had dropped to critical levels. She gets a call at 5 o'clock in the morning stating, you need to get up here. We don't think he's going to make it. If anything else happened, if his oxygen levels drop any further, there's nothing else we can do for him. So I tell folks all the time, I'm the survivor, she's the hero, because she went through a lot. I lost 52 pounds being in the hospital, and it took me nearly a year after I came home to fully restore and recover. And I still have nerve damage in my arm from being in the prone position on the ventilator for so long. They've actually learned from that. So now they come in and they rotate you every 2 hours. But again, this was so early on, they didn't know what to do. In fact, the nurse told my wife, he's so sick, we don't know what to do.
Yeah. And so it was nothing but God's grace and Johns Hopkins' good, ability to just do good critical care management. They didn't know anything about COVID, but what they did know was about how to treat critically ill patients. And it was that coupled with our prayers and faith and grace and all those good things and good resources that we now talk about that really, really allowed us to have a success story. And so we're on the other side now. We have written a book. Our book is Praying Wife, Healed Husband, How We Survived the Death-Defying COVID-19 Experience. And that's our way of, it's a faith-based memoir, but it's our way of actually charting out all of the progress from beginning to end. You can see how, a real life, modern day biblical miracle unfolds. It's a memoir. Actually, when my husband was in the hospital, I was writing down notes, vigorous progress notes every time I would talk to his doctor. And by the time he ended up leaving the hospital, I had a binder about this thick, a couple inches thick, I was also texting to my prayer group, and I was also journaling on the back end. And so that was largely the content that is in our book. We have lots of pictures. There's pictures of him the day that he alluded to when they didn't think he was going to make it, when he was on the ventilator. We were able to get pictures of him on the ventilator. And so those pictures are in our book. And I strongly encourage you to read this book. If you are in any kind of way on the fence about the vaccine, I think that this book will change your mind. Because again, we are major vaccine advocates. We wear our masks religiously, even still. And, my husband has had a couple encounters in public where people were like, why are you still wearing your mask and stuff? And what do you say, babe?
Well, the one lady said to me, she doesn't like wearing her mask because it fogs up her glasses and she can't breathe. I said, well, that's interesting. If you have a tube down your throat, you can't breathe either. And I'm speaking from a COVID experience. She kind of looked at me and walked away. But
right.
Yeah, it's just amazing to me. People are not taking this seriously.
Right. And when you think,
oh no, go ahead. I'm sorry.
I was just going to say, we know firsthand all the things that he went through. Just like he talked about his body temperature. And, when my husband came home from the hospital, he was like a baby,
Little T.
Yeah. The only thing he could do was feed himself, but he had issues with walking. He had to learn how to walk again. He had to learn how to swallow again. All these things from being, affected by COVID, it ravishes your body. And then he was on the ventilator and all those things. There were just so many different things. Walking, like you said, he lost a lot of weight, and sleeping. He just started sleeping regularly this year, like within the last few months. And just so many different things that we take for granted, and just seeing and knowing firsthand how COVID can ravish your body. My question is, why in the world would you want to expose yourself to this unnecessarily? At this point in time, anybody who gets COVID at this point in time, you're signing up for it because it's definitely preventable with the vaccines.
Yeah.
And so, I just from the heart, we really just encourage you, please, please, please think this, rethink this. Please, first and foremost, pray on it, talk to your doctor, and make an informed decision. And that's, everything that we're going to say today that's going to be the premise for everything that we talk about today.
So first of all, thank you so much. It is, I still have a lump in my throat, right? And I have the book. So, I'm almost sure I saw you on like WJZ or somebody, right?
Yes.
And it was so powerful, but so not two quick things, and we won't make them quick. And I'll obviously, Dr. Weeks, we'll tag team on this, but I know that we are expecting another doctor to join us probably in about 20 minutes or so. But it's interesting. I'd like to know if early on he got what were your thoughts when they first started shutting things down? So take us back to March, and I know it's March 2020 because I just started my job. When we were trying to figure it out, like, should I send my team home? What were your thoughts then?
Well, interesting. Back in early March, I had a conversation with my director. I work for a law firm in Washington, and the firm had just started to make an announcement that they were going to close down on the 16th because of this virus. They were concerned about people getting sick. So I'm pretty well known in the firm, and I stopped out and I talked with the director, and I said, hey man, this COVID thing, I said, what do you know about it? Do you think anybody in here will ever get sick? He was like, man, I don't know. He says, but as big as we are, it's inevitable that somebody's going to get sick. Now, thinking back, who would have thought it would be me? So I remember I wasn't feeling well. That was a Friday.
Friday the 13th was our last working day. Friday, March 13th was the last working day.
And all of a sudden I just started feeling, kind of fatigued. And that's really not unnormal for us because we do a lot of hustling and bustling. I wasn't even thinking COVID, it was the last thing on my mind. But as the week progressed, I was classic. I had all of the symptoms down to a T. And as much as I was trying to fight it, no, this is not COVID. This is just a cold. This is my allergies. I knew something was wrong when I developed the cough. The cough was so intense that every time I coughed, my chest would just be on fire.
And it just came on so quickly. It was
quick.
just like rapid and just rigid. It was just, the onset of it. It was like nothing, we never experienced anything like that before. We kind of felt at that point that it probably was something more than flu because it was just so fast and furious. And so Friday the 13th was our last day. And then that weekend, as he said, he just started getting progressively worse. And I felt like I had a sinus infection. So it was really kind of, the cold that really, the cough that really made us alarmed. The rest of the stuff, the fever and all that, it wasn't that big of a deal. And I was just kind of nursing him through it, through the weekend. And so, I kept telling him, I kept giving him Tylenol to break his fever and giving him cough medicine and stuff. And his cough wouldn't subside, but his fever was intermittent between like 99 and 100. So I said, babe, we're going to wait. It's Monday morning. I said, if your fever hits 101, we're out of here. We're going to urgent care. And like clockwork,
Yep.
Monday morning hit 101. So we masked up, we suited up. I'm in the healthcare industry, so I keep, some of that stuff on hand. It was still early on, so mask and, PPD and all that stuff was not really, that popular then. But we had masks and we had gloves and we suited up and we went to Patient First in Columbia. And so it was so early on, again, that they weren't doing COVID testing, but they were on alert for COVID symptoms. And so we came in and they tested us for RSV and strep. We were both negative, but because of his symptoms, they referred us to the hospital for further testing. So we went over to the hospital, Johns Hopkins, Howard County, and we got tested. They were all in their, suits that you see on TV now, but it was foreign.
That was an experience. You
Yes.
could clearly see they were very
They were
nervous.
scared, yeah.
And
And just to put things in perspective, we
Yeah.
were the 4th and 5th in the county diagnosed. That's how early on it was. That we
Yeah.
actually saw the numbers change on TV after we got our diagnosis. That's how early it was. And so the next day was Tuesday, March 17th. We got our results back. And that was Tuesday. And by the end of the week, my husband started to feel a little bit better, but he still had this cough. And so that was kind of the trigger for us. And so I was in touch with his doctors. And we talked to his doctor. He has asthma, but it's controlled asthma. He has allergies, but he hasn't taken inhalers or anything in years. But he has, a pulmonologist that we have a good relationship with. And so we actually called him and told him, he said, keep an eye on the cough. If it persists, by the end of the week, we'll have him go into the emergency room to get a CAT scan. And that's exactly what happened. I called him on Friday. I said, hey, doc, he still has this cough. He says, no, people are dying. This is how people are dying. Get them to the ER immediately. People are dying by waiting too long. Scared the crap out of me. We were in the ER in less than an hour, and they received us on the curb, which in itself was a blessing because as it turns out, he ended up having emergency intubation 45 minutes later. Literally, I sat in the car and waited for him to come back out.
Andrea, you talking about a scary moment. When she dropped me off, thank God our pulmonologist had made some arrangements for us because I could have easily passed if I had to go through the normal channels of going in the emergency room. So when, like she said, when we pulled up, opened the door, the nurse says, Mr. Clark, is that you? And they were actually waiting for me. So she wheeled me in. She took my vitals. I didn't have a fever because Marcy had already given me some medicine to break that fever. So I'm thinking I'm going to go in and get just a quick CAT scan and maybe a lung treatment, and I'll be on my way. But because COVID was so new, they couldn't even do the CAT scan because they didn't know how to prep the machine for a person that was positive. So the doctor and the nurse said, look, he looks really sick. Let's just get a chest x-ray and see what's going on. So I basically got a chest x-ray and I'm sitting on the bed when the doctor walks in. And I was like, okay, doc, can you give me my prescription? I'm ready to go home. I'm tired. And he said, Mr. Clark, your lungs are failing. I need to intubate you immediately. And I was already drowsy from the Tylenol. Let me tell you, you talking about your hair standing up on your neck. I will never forget that. And at that time, I think she was trying to reach me on the phone. Yeah, I was in the car in the parking lot waiting for him to come back out. 45 minutes later, he didn't call me and I started to get a little nervous. So I called his phone. He didn't answer. And he called me back 5 minutes later, put the doctor on the line. The doctor said, I'll never forget. He says,
things are a lot worse here than we envisioned, and we need your permission to do an emergency intubation. And you could just imagine how I must have felt thinking he was coming back out any minute now. And now I'm realizing that possibly this may have been the last time that I've ever seen him, that I'll ever see him again. And it did end up being the last time that I was able to see him, in almost a month. We were able to see him for, a short period of time, 2 weeks later when he had that event when they didn't think he was going to make it and they let us come in. But for all purposes, seeing him, in his physical state and him being able to recognize me and vice versa, I didn't get to see him until 46 days later after that.
So you raised something super interesting, and Dr. Weeks just sort of faded away. She's here twice, both she and Roxana. One of the things, that you said, Mr. Clark, that just, I'm happy about, but it also saddens me, and that is, obviously you have a great relationship with your doctor, so you were able to be seen. And I wonder about, and Dr. Weeks, I know maybe you can hear me, everybody's internet is going, but I wonder, I often worry about equity, right? So here's what I wanna say is, she has some background in the medical field. He obviously is an educated man. And they also live in a relatively affluent county, right? So, here's what I think the difference between you and some others. Obviously, I'm a huge woman of faith, so I get it, right? I'm not confused about how we're even having this conversation.
Mm-hmm.
But what I think is important is to talk about access and equity for others, right?
Mm-hmm,
So part of what we see in some marginalized communities, especially in the city, so people either don't go, they're like, I'm just gonna wait, for a whole number of reasons, or we've got these horror stories. We don't have to go back as far as Tuskegee. We can talk about Henrietta Lacks. So I mean, and the nameless others. And so, Dr. Weeks, I'd love for you to just sort of talk about, the other drivers around this. So we know the impact of COVID especially on communities of color, but thank God that he had his access look different than it does for most. And so I'd love for you.
Jack, really quickly before Dr. Weeks speaks, I didn't want to cut you off. Go ahead, but I did want to say something before she starts. Go ahead.
Oh no, you go ahead.
So one of the things that I just wanted to say, which I think is a great segue into what I think Dr. Weeks is going to say, is one of the things that me and T talk about are the importance of resources, right? You having and employing resources. And you don't have to have a lot of money and things, to employ resources. And one of the resources that we talk about is having a personal physician. And that is everything. And just like we talked about how important it was that the role that his physician played in being able to call ahead for us to go into the ER and all of those things, right? And even the timing for him to even advise me, he needs to go right now. Because we know stories firsthand, people that we know and that we love who never made it to the ER, right? Or they went to the ER and they weren't able to get in because they didn't have a physician advocate for them. Because if you remember early on during COVID, you had to have a physician advocate for you to even get a COVID test. Right. And a lot of people really, got burned on that. So we talk about the importance of having a personal physician. We also talk about the importance of having health insurance, health and medical insurance, right? Which our forever President Barack Obama fought so hard for everybody of all, income levels to be able to have insurance. And so I just wanted to just say that, our story, yes, we did have resources and things in place that definitely affected, positively our trajectory. But now, again, we're on the other side. We are telling people about the things that we had, but the things that they too can have that, they're not excluded from. And that's, personal physician, health insurance, and those things. They can have those things too. And we strongly advocate for those. So I didn't mean to cut anybody off. I'm done.
No, I think it's important. So I appreciate your feedback. I know what we see. So I'd love to have Dr. Weeks have a conversation about, or just sort of speak to that as we talk about equity and access and, so I'm going to go on mute, I promise.
Me too.
No, so some very important things you guys have started talking about. And here's the truth behind it. Unfortunately, prior to COVID, we still had so many inequitable health issues in our communities that before even when COVID came into play, it was hard for even start to say, what do we do for our vulnerable communities? A lot of people didn't realize this. The last year, we started shutting down things again about March 13th. But when the data came out from CDC by April, like April the 4th, from our federal government, they started to say open stuff up by Easter. And so the issue with that is, or what a lot of people still don't realize, about 20% of the people in this country still don't have health insurance. About 18% of people in Baltimore City still don't have health insurance. And a lot of people keep asking the question like, okay, we know there was an Affordable Care Act. We know all this stuff happened over the last decade. Why do people still not have health insurance? We still have people that don't qualify for Medicaid, but they don't make enough money to be able to afford housing, food, and other things they need, necessities, along with paying $200, $300, $400 a month for health insurance. And so one of the biggest things that we see is that people who have chronic diseases such as diabetes, hypertension, and cholesterol, they still don't go to the doctor. They still don't get their medications. And this was just prior to COVID. Another issue that we see that there are people who do have health insurance, but there's some people who do pay this $200, $300 a month. There's some people who have the discounted health insurance, but they don't make enough with their income to afford the copays, the co-insurance, or the doctor bills. Now, one thing that we talk about in this country, we talk a lot about debt from mortgages. We talk a lot about debt from student loans. But we don't talk about medical debt. Medical debt is the third largest debt in the African American community that keeps people from getting credit, from people having access to economic opportunities. So when we're looking at what are those conditions that have been unequitable, we have tons of people in this country who don't want to go to the emergency room because if they know they run up a bill at the hospital, they're going to end up in medical debt and possibly in collection. So when we're having this conversation about equity and, people can easily just go to the hospital, a lot of people don't want the economic impact of what comes from going to the hospital. There's a theory we use in public health called the theory of reason, action, and planned behavior. And that looks at how people make decisions about what is priority in their life. And one of those things that people see as priority is making sure they have housing, food, clothes, make sure that their children are taken care of. And oftentimes medical attention falls farther down on that list, especially in the African American community. The other thing we have to look at is capacity. Last year when COVID started, a lot of frontline workers, even in Baltimore City, are Black and African American. So they lost their jobs. They didn't have the income they were having. And some people were hourly, so they couldn't afford to take off of work. So when we look at what do people prioritize, last year people were trying to make sure they had food, clothes, shelter. They were trying to make sure their children that were now being homeschooled had somebody watching them, and some of them were at home by themselves. So when we looked at, the equity issues, a lot of people prioritize health as last. Even right now, while we're seeing a lower uptake in the African American community, one of the reasons of getting vaccinated is because people are still trying to recover from the fact that they did not have income last year. Some people were evicted. Right now, a lot of states are listing that with different memoriams that were protecting people. And now, right now, that's being listed in the community. So there's just a lot of other factors when we talk about equity and the inequitable conditions that impacted people being able to really address their health during COVID. So I'm going to stop right there for a minute because I could talk all day about that, but we have to consider all those cultural determinants of health factors that kept people from being able to go to the hospital, go to primary care, and have consistent health care to address the issues going on with it.
I'm glad you raised that. And again, it is, I think this helps bring light to, because I love, really on so many levels, it was for Mr. Clark, right? Between life and death, right? The fact that he was able to be ushered in, that doesn't always happen, especially when you, in some marginalized communities. So I appreciate us having this honest dialogue about equity, because that's where we are. I do see that we've got two other doctors on the phone. I mean, not on the phone, that have joined us. One is Dr. Kyla Liggett Krill. That's not her picture, but I'm sure whoever that is amazing. And then Dr. Kana, did I pronounce that right?
Yes, Dr. Kana.
Okay, Dr. Kana, could you just tell us, so we've been having, first of all, let me just say the rock stars here are the Clarks. She's been showing off since she got on. I'm kidding, but we really are, we've been having this discussion about not just equity and access, but about, we've not talked much about messaging, but if you could just tell us who you are and just give us a sort of a one-liner about what you do, and then we'll just bring you right in.
Okay, thank you. Thank you for inviting me. I'm very honored to be here. I'm a family physician at the University of Maryland. I've been there for 31 years. And I was born in India, came here 34 years ago. And I think of Baltimore as my home and have taken care of the Baltimore community for a very long time. When COVID started, I was put in charge of tracking where COVID was happening. And I started to see that in West Baltimore, it was these homes where there were multiple families. There were people who were dropping in that were getting really, really sick. So when vaccine came along, I started to see that it was the reverse. People who were living in those areas were not coming for vaccine. And that got me energized. So here I am talking to you and hoping I can bring you some information, some pearls, something that works.
So thank you, and thank you for your work. We appreciate it. And then Dr. I think that is, I don't have my glasses on. If you could either, is that Dr. Tran?
That's Dr. Tran.
Oh, okay, Dr. Tran. I know, as good as Dr. Liggett is, I didn't think that was you, Dr. Tran. Would you just, thank you first of all for joining us. Hello. I was like, that's not Dr. K, but we'll go with it for a moment. If you could just obviously introduce yourself and give us just a blurb about what you do and where you are in this moment.
Sure, thank you guys for inviting me. I was going in as Dr. Liggett because she had sent me her link, and I guess that automatically made me become part of her, which I would never because she is amazing. So hi everyone, my name is Dr. Deanna Tran. I am a pharmacist, and as a pharmacist, I actually also work at the University of Maryland Family Physicians. And I help with seeing those patients and helping with medication. So think of if you have a lot of medicines and you have questions about your medicine or would like help with pill boxes, that's kind of what I do. But my background is actually in community pharmacy. So I help in community pharmacies like Giant and CVS. That's kind of where my background is actually from. But I'm here with Dr. Kana just to share some of my resources, including a hotline, which I don't know if this is the great opportunity to share that, but at one point I definitely would love to share a hotline that we have as a resource for anyone who has questions about COVID vaccines.
Oh, I think absolutely. If you put it in the chat, Roxana will make sure it's available. I think that's perfect. And so let me just say, one of the things that the Clarks have made it very, very clear, they've taken us through their journey, and they are huge proponents of the vaccine. And so, and we talked early on about some of the numbers. It's just staggering, and they shared their story about access and equity. And then, so Dr. Weeks has really been able to talk about, as much as we like to think everybody has access, they don't, and equity. You said something interesting, Dr. Kahana, that I want to raise. You talked about, you were responsible for tracking, and that you noticed some of what you saw were people coming from these households with multiple families. And if we could talk a little bit about that, but one of the things that the Clarks said early on, which is just mind-boggling to me, they still don't know where it came from. Now, obviously, but they live in Columbia, and not that doesn't mean that there can't be multiple families living there, but I wonder, when we start to talk about, we see it, Dollar Doctor, when we start to talk about tracking and tracing, how is it that, you know, tell us a little bit about what that looks like and what that means.
Yeah, thank you so much for that question. And I'm so sorry to hear about your Colombia experience. So at Family Medicine where I work, we have 3 sites. One is in Colombia. It's right on 108, right across from Expectations. And when we started tracking our numbers early on in March the 12th is the first patient that I put on my dashboard. We started to see that there was definitely a very tight cluster in Baltimore, but there was a huge number of people with COVID in Howard County who were coming to that site. And the numbers were so disparate that we would see 800 in Colombia and 400 at my site here. It was the most shocking thing. And so although we were thinking that in Baltimore, it was about having somebody sleeping on your couch maybe in the night, or perhaps a daughter came by, you know, or there was more than one family living there, and that was the mode of transmission. But in the Colombia community, I feel like that those people who live on the east side of Colombia are people who had to go out to work. They were frontline workers, you know, they had to be going to their jobs. And in the early days, none of us really knew very much about distancing and how tight the mask had to be and what kind of mask to wear and how long to be in the community of somebody who has COVID, you know, the 15-minute rule, which ultimately became known to everybody. We didn't know these things. We all thought you got it from food, and so don't go to the groceries, or people stop going to the grocery. That wasn't where we were getting it from. We were getting it basically because people were going out to work. You know, the schools shut down, so teachers stayed home. But the groceries never did. Groceries didn't, pharmacies didn't. Some of these essential businesses were all going on. So I think some of the sources of that infection was household contacts. I think that was a big reason. And the second, of course, was frontline workers. Frontline workers were getting sick left and right. And if you came to our office, you would see, we used to have on our dashboard a section for who's out today, how many medical assistants, how many residents, how many doctors, because we were in these little spaces, 8 by 10 spaces with a patient who was sick. And so when you're taking care of a patient, I mean, inevitably you're sitting up close, you're talking, you're listening, you're touching, and people are getting sick left and right. So, and because this virus is so infectious, there was really no great way to prevent it. So in fact, when this vaccine came along, it was like, I mean, initially when I got called by the university in December, on I think December 13th, I got my first email to say, you need to come in and get your vaccine. And I was like, I'm not going. I don't know what this is. You know, I have to do some more reading or something. And then the second email came, you have to come. You're in whatever class 1A or something like that. You have to show up. And then I guess I scheduled it. I went, and I knew we were the experiment, you know, who we were, because they said, well, okay, we did the testing or whatever in animals, and now it's these healthcare workers. Let's just get them in, vaccinate them, and let's see how many of them has a reaction. So I guess we said, okay, one for the team, let's just go. And so we went, but it was scary. It still is. If you didn't, I now am the back office for Novavax and Moderna, and previously for Pfizer. So the clinical trials that go on at university, when those patients get a cold, they get sent to my office and we evaluate them for them so that they can assess how much COVID happens after you get the vaccination. So it has been quite a journey for us. It has been a long journey, but now that I have seen so many people who've been vaccinated and seen that the vast majority do so very well, that I really think it's time for me to get out into the community and talk to people, because we don't want to see these disparities. We don't want to see people on ventilator beds. You know, we just don't want to see them coming in to see us even if they don't have to.
So you raise an interesting point, because again, the Clarks are huge proponents. Mr. Clark talks about being intubated and really almost losing his life. And so and I asked, what they thought early on, but he got it early on. And so, because, a lot of people are like, I don't have to do that. I don't have to, but he got it early. But you raised something else, and Dr. Fran, and please, Dr. Tran, if you, jump in. One of the things that, we talk about, I shared with Dr. Fran earlier today, the chairman of our board is a psychiatrist. And one of the things that he had heard was, I think nationally, and I'm going to get the numbers wrong. Dr. Fran will help me get them right. You all will help me get them right. But only about 20% of African Americans, 2022, have been vaccinated, right? And I asked, I was like, is that in the country? Is that in the city? I think across the country, it's even more staggering. So it's super scary. But one of the things that we often talk about, especially for communities of color, Black communities, is, what should messaging look like, right? And I shared, this is gonna sound silly, but I shared, we've talked about this notion of herd immunity, right? And I know as a Black woman, the last thing I want to hear is about herd. I used to, this whole notion of herd immunity. And I wonder if those kind of words and language and all of that, that doesn't help. When I think of, I think of herds, I think of cattle, I think of slaves, right? I think of all of those things. And so, and I think it's incumbent upon us to obviously have a platform like this, like the Clarks and like, the entire team, to sort of say, let's move past the language, but we get stuck there sometimes. And so, and Dr. Fran has made it clear that it's not about vaccine hesitancy, but it is about, we're deliberating. But in moments like that, when I hear the word herd, like I get immediately turned off. And I think about it for a number of reasons. Our historical ties to fraternities and sororities and branding and herding. But that's my piece. So Dr. Fran, I'd love for you to weigh in about, this, again, the language around herd immunity. I saw in the chat that somebody said language does matter. So maybe can you talk to us a little bit, and then how do we move past that if we do?
Right. So one thing I tell people all the time, labels matter. Language matters and labels matters. And what really happened is, I'm just going to run it back real quick to Tuskegee. From Tuskegee, basically we were used as the guinea pigs for research. And out of that, there were several labels put on our community, our bodies, our health, and what we consider to be quality of life. I don't know if anybody was able to read the Baltimore Sun, but last Sunday, the Baltimore Sun came out with an article, and one of the commentators on the article, they were discussing, the uptake of vaccinations in Baltimore City. And one of the commentators said that, since only 1/3 of the residents in Baltimore City right now are fully vaccinated, we should label the Black residents in Baltimore City as selfish. And I said, one thing that we're definitely not going to do is continue to allow those who do not have the lived experiences from our community label us. As Black people, we're humans. We have names, we have feelings and emotions. And really, like a couple of times, labels go on food, label goes on organizing containers, clothes, but labels should never go on people. And so when we're talking about herd immunity, when we're calling people selfish for not wanting to get the vaccine, and media is starting to take the hesitation conversation to blaming a certain racial group for not taking the vaccination, it puts a negative connotation on the community. And we have to realize, again, Tuskegee is one of the experiments that started this labeling on our lives and our health. I tell people all the time, it's very kind of a disrespectful thing to put these labels on the Black community when you don't share our lived experiences, but then these labels go on with us the rest of our life. And it kind of predetermined for a lot of people, because they put these labels on themselves and they take these labels as, this is what my health outcome is going to be, because somebody's already told me I'm unhealthy. Somebody's already told me that I just have an inactive life or I'm incomplete. So when we put on different labels, like, we're hurting people in and we're going to label them and categorize them, it does take people back to history and the negative connotations we have in our community. And just that point with Miss Andrea Brown bringing up about hesitation, I tell people, a lot of people, it's just that the hesitation more so is not about really the vaccine itself. It's about the healthcare system. A lot of people are worried that the healthcare system isn't trustful. Even myself, like I said, I do some work with the health department and different other systems in Baltimore, and a lot of people don't trust the system. And that's the historical medical treatment in Baltimore City. Right now, a lot of people don't know, but in childbirth in this country, Black mothers are dying at 3 times the rate at childbirth than our counterparts of white women. Why is that when childbirth is something that we've advanced decades on in technology, but still our Black mothers are still dying? So just thinking about that in childbirth, a lot of people are thinking, why should I trust the medical system to give me a vaccine? And so just on the reverse of that, I also tell people too, I'll give you guys a real life example real quick. So the state of Maryland, actually something I had to actually advocate hard for the Black community, they wanted to come on North Avenue and on Greenmont and bring our National Guard in and set up these huge kind of herd immunity vaccination clinics. And, I tell people, you wanted to have white men with buzz cuts and uniforms come set up in our Black communities and kind of push people to get the vaccine. I said that method would never work simply because our community, one, we're not receptive when we have that type of forcefulness come, especially by the type of forcefulness of a National Guard who's only been to Baltimore recently in 2015 with Freddie Gray. And so just a whole negative connotation about that herd immunity and forcing people in, and it comes under in this kind of police authority had a negative connotation to it. So we kind of had to push back on that. So again, our labels, our language, and also our strategy around what we do is important. And that has a lingering effect. Tuskegee was decades ago, but that still has an impact. So I'm gonna back off now and let somebody else go in, but definitely that's just a little bit about why we really have to be careful about what we.
Thank you, Dr. Fran, for that. So I think that's important. And you mentioned something, and I'll definitely let Dr. Kahan and Dr. Tron, and then we got somebody else. She did have Dr. K's name, but she's with us, so we'll have her come on shortly. But one of the things that I think I heard like with a heartfelt, that the Clarks have relationship with their doctors, right? They have relationships. So when their doctor said, go now, they went. She took him. She left him, thought she was gonna be able to, he'd come back in the car. But that is a difference. They went because they have relationships. So, the doctor said, if he doesn't get better by Friday, call me. She called, she said, he's not better. He said, then we're not fooling around. It's early on, but that's relationship, right? And so there's a mutual trust that they have that we don't always see. So I can appreciate that. So, Dr. Kahana, as you talk about, some of what you are doing, no worries. Okay. No worries, Dr. Trent. Thank you for hanging out with us, even though you pretended to be Dr. K for a second. But we do have the information in the chat, and Roxana will get that out. I just, I think, again, we've talked about herd immunity. We talked about, folk are still trying to figure out about the vaccine, right? I mean, its effectiveness, is it real? Are we gonna have, 6 arms in 10 years? I mean, it sounds silly, but those are legitimate concerns, right? And and so I'd love for us to have that conversation about, what's the real danger of not getting the vaccine and what's the danger of getting it? And so I love to have that conversations. Now, the Clarks, obviously, they've both been vaccinated, but after he had, almost lost his life, the vaccine wasn't available then. I mean, it was back in March 13th is when, their lives changed. So we'd love to hear you to have some conversation about. And yes, and Dr. Well, before you do that though, Dr. Kahana, pronounce your name for me, Dr.
Hi, I'm Dr. Silva. I'm also a physician at the Department of Family Medicine. I'm a family medicine physician seeing kind of full spectrum from birth to death. And I work with Dr. Khanna and Dr. Tran and Dr. K on this. I had Dr. K's link, so I couldn't figure out how to change my name for a bit.
I've been giving everybody a hard time about that. Okay, so I see the 18 came out for this. All right, I love it. So again, you know, we've been talking about, you know, less about hesitancy, but you know, how the Black community is deliberating, should I not? But so if you could share, obviously medically, professionally, what the dangers in, you know, in not getting the vaccine for real, as we know it. And then, you know, the dangers of getting it, if that's such a thing.
Mm-hmm. Thank you so much for that question. I will say that my information, first of all, you want to know where I get my information from, comes from a real lived experience of how sick my patients have been with COVID and how we have tracked them in various ICUs around the city for days, waiting for them to turn the corner and to go home. And we have lost a few patients because, you know, there was no good solution at the beginning when COVID came along. There was no remdesivir and monoclonal antibodies and these other fancy things which have steroids. They didn't know what to do with them. So I am going to say that COVID is a terrible disease. It's terrible. If you look at the young pregnant moms who come in with COVID, I mean, they really suffer. They really suffer. I mean, to come in with 5 liters of oxygen is not uncommon. For these girls who come in, they need to have so much oxygen that is just to keep them alive is tough. And so it isn't a question of if I'm old and if I have heart disease, then I'm going to suffer from bad COVID. It's also when you're young, you know, there's no real age that's protected. Yes, you're less likely to be in a hospital ventilator bed if you're younger, but you're certainly at risk. And now that we have these new variants that are developing, variants are just simply things which happen when a virus replicates, you know, 1 to 2, 2 to 4. And so when it does that, some gene material changes, and that's called a variant. And that is the way these viruses survive, because once you develop a therapy to one type of virus, it just simply changes itself and it keeps doing that. So I think in terms of severity, COVID is one of the worst viruses we have. If you think back to Ebola, when Ebola was happening in Africa, we were all like, oh my God, that did not come here. Well, COVID is not very different. You get it, and if you have risk factors, if you're older, your chances of dying are pretty high. And I think my own very dear friend, we lost a dear friend of ours in January who had been on a ventilator for a month. And he was 65 and, you know, hypertension, but there's no criteria to predict, okay, this person is going to drop dead. This one is not. You can't do that. And now that we're opening up, you know, we're walking outside, our only line of defense is that one mask. So we really have to think about a backup plan. You know, what's our backup plan? What if that mask is loose or it falls off or it's not thick enough, or I'm in contact with somebody for more than 15 minutes who has COVID, who's breathing all over me because they're not masked, then what's my risk of getting it? And I think if I was to tell you based on data, the Novavax and these Moderna patients who we see regularly, we see them all the time, they are doing excellent after the vaccine. You know, these are not patients who are suffering from anything. And we had one woman who came back from Uganda who ended up getting COVID. And they think it's one of the variants that she picked up in Uganda, but she had it for only a day and a half. So this vaccine is effective. You know, it works. Even if you're exposed to COVID and even if you pick it up for a day or so, you're not going to end up in the hospital like a person who was not vaccinated. I was just in another group where they were talking about going back to pray, you know, something basic like I want to go and pray with my community and I want to stand in the same room with them. Well, if you want to stand together a foot apart or even closer, then you really do need to think about, how am I protecting myself? You know, I'm going back to class tomorrow, and how am I protecting my children? If I'm a teacher, how am I protecting myself? And am I bringing COVID home to my family? Because we're now opening up. Remember, this is the time when we start to really get out of the house. While we were sitting in the house, it was a little bit, you know, you were kind of protected. You didn't go outside at all, and no one came to your house. Then you were okay, but now we're getting out of the house. Now, a protected person is probably better off than a person who doesn't have the vaccine and doesn't use a mask, definitely. And I think to your point about who gets this disease and who are the people who are complacent about the vaccine or who still need the confidence to go and get it. There's a federal grant that I'm part of, and the feds are telling us, go to areas of persistent poverty, go to areas where it's medically underserved, go to places where there's health provider shortage areas. You know, that's where they want us to go, where there's social vulnerabilities, you know, where there's housing which is shared, transportation that doesn't happen, access to care which is not existing. And those communities are of all, you know, different shapes and sizes. It's just that we have been tasked with finding the most vulnerable communities, to trying to be the trusted messenger from whom they want to hear, and to come out and to tell you our lived experience, and to share with you that this is a good method to give yourself a second line of defense, you know, to prevent yourself from being on one of those vented beds.
So thank you. And thank you so much for that, Dr. Khan. And Dr. Silva, I'd like to ask, you know, I do want to, one of the things that the Clarks started out with, they, you know, obviously they told us about their journey. You guys missed it. It's so powerful. You probably would have been in tears. But one of the things that he was healthy, right? And like, you know, he worked out, and, you know, you did say you worked out, right? No, he did. He worked out and all that kind of stuff.
Unmute.
Absolutely.
So, you know, so we often think about, so we often think about, you know, he's worked out, people are healthy, but that's not necessarily the case, right? And so it doesn't mean, so Dr. Silva, I'd love for you to sort of talk about, you know, he talks about how healthy he is. I try never to miss a run in the morning, even in this ridiculous heat. I'm also, I've also been vaccinated, but it was a struggle to get me to be vaccinated. And I had lots of, I struggled with it, but I say all of that to say, I'd love for you to speak to, since there's no template, that it doesn't matter, right? If you could just sort of, based on some of what Dr. Khanna has said. So I'll keep quiet and let you talk.
Yeah, so it seems like you want to know, it's not just the vulnerable people who are getting sick, it's also people who are healthy. And that's something that makes COVID really different than some of the other viruses that we see, like the flu, which we generally think affects really old and really young. And while there are people who have a lot of health problems getting really sick from COVID, we have seen people who are young and healthy, who are put on ventilators, who are really affected, even though we are not seeing, even though we didn't see, a previous health problem in them. And that's really why we're moving towards wanting to get those people vaccinated, wanting to get our youth vaccinated and our adolescents vaccinated, because they're still at risk. And even if they may not end up in the hospital for a long time, or if they may not end up in having a severe illness, we're now seeing those sort of what they call the long COVID symptoms that people are having even after a mild disease of, chronic fatigue, problems with their smell, kind of chronic shortness of breath. And so it's not only protecting you from being in the hospital, but really protecting from those long COVID symptoms as well, if you were someone that had even a mild illness from COVID. Does that answer your questions a little bit?
No, it definitely does, and I appreciate that. And I think, and I'll ask Roxana, there may be some questions in the chat, and so I think as we start to wrap up, what is really at stake, right? And so, and Dr. Fran almost said it earlier. I mean, that number just just breaks my heart, right? That nationally, it's only 22% of Black people have been vaccinated. I mean, that just, and she said, I think in the city, and you guys may know these stats as well, we're under 30%, I think. And I don't know if we have numbers for the state. Like, what does that look like for the state? How many Black people have been vaccinated? What's the percent? But what if you could talk, both of you could just share what really is at stake here? And I'm, not just will there be another shutdown, right? Is that if we don't get enough people vaccinated, what really is at stake? Oh, thank you, Roxanne. 20% of the Black community in Baltimore City. So.
I think Dr. Khanna is the best person to speak to sort of the stats and the numbers from that. But from my opinion, sort of what's at stake is that we already know that the Black community is a vulnerable population. We have higher rates of many chronic diseases. And so the low vaccination rate just puts that already sort of vulnerable population at even more vulnerable to COVID and to this to kind of the long-term effects of having this virus. And so we know as a medical community that there is distrust in the medical community and in this vaccine. And we really got to figure out how we can do that to really best protect our patients, to best protect this community that we really care about and that we both work in.
That's fair. Okay. Roxanne, I saw somebody said that they asked a question earlier. And I mean, I know you're saying something brilliant, but I have no idea what it is because I can't hear you. No, but your lips are moving. No. So, well, while you're doing that, I know that there are a couple of questions. Somebody asked twice about it, but I can't see it. But Dr. Khanna, could you talk to us a little bit about some of those stats? I mean, that is just, I saw when we were talking earlier about the stats, I saw, Marcy just sort of shake her head, like really, with a heaviness. So love to hear that. Can everybody hear her?
No.
Oh,
No.
okay. We can't hear you, Dr. Khanna. Maybe you and Roxana are hanging out together. Nope.
Do you have to unmute them as a moderator?
No, they're unmuted. Okay, wait a minute.
This is Dr. Silva. While they're working on that, I can answer at least one of the questions that came through the chat. And this was like, I'm concerned there may not be enough evidential data with Black and Latino in clinical trials, not only with COVID, but other diseases. How is the medical community working on this inequality, which seems to be ongoing for years? And
nice.
I don't know the name of who submitted that, but absolutely, that's a really good point about that inequality, that Black and Latino people are enrolled a lot less commonly in these clinical trials. And I know, as Dr. Khanna had mentioned, some of the clinical trials do occur at the University of Maryland, and we participate in some of them. And they are actively trying to increase the amount of Black and Latino patients, also from like Asian communities, Native American patients who are enrolled in them. And that's an ongoing effort, but it is hard. And that speaks back to that sort of distrust in the medical community a little bit, that if you have that distrust in the medical community, you may not even want to enroll in a trial. And so it's really that first part is really building that trust back so that we can have more of those community members enroll in those types of trials so we can give you that evidential data.
So I just wanted to
thank you. And Alicia said that. Yeah, thank you so much. I see you, Dr. Khanna. Yes, Marcy?
Can you hear me now?
We can hear you now. Okay.
Go ahead, Marcy.
I was just going to say, it seems that the hesitancy from the people that I've talked to is because of either the length of time that the vaccines have been out, so lack of information. Also, I'm seeing with the teenagers, the younger crowd, the millennials and the teenagers, that is either lack of information or misinformation. And I was actually talking to a coworker who was telling me that her daughter felt like they were being bribed, with the lotteries and different things to take the shot, but nobody was really explaining to them why they should get it. So it seems like there's just a lot of misinformation, I think that, or lack thereof. And I know that the millennials and, like I said, the teenagers live on social media. And I think they're getting a lot of their information from there, and a lot of false, information. And it's just kind of just going from there. And so I think that if we can continue to have these kind of discussions, or maybe even, people like myself who've been affected, myself and my husband, or people, in the medical community can actually go out into the communities and reach out to our people and talk to them about why, they should get this. And I'll be honest with you, my husband and I were not advocates of the vaccine day one, for a lot of the same reasons as everyone else. We were, scared because of the history of vaccines, and also because of, the lack of information. I'm a 20-year pharmaceutical representative. And for me, so I understand about drugs being fast tracked and a lot of different things that, the average person doesn't. And that may be, I may know enough to be dangerous to the point where it would screw me not to get the vaccine. But at the same time, I was convinced, because I was already kind of doing my own research, but back in, I think, December, before the vaccines were approved, I heard and saw somebody, a physician actually from University of Maryland, a Black lady. I wish I knew her name now, but she was speaking to a prayer group, and she just broke it down, and it made so much sense. And she said, if you look like me and you're eligible for a vaccine right now, that was when they were a free vaccine, and they were getting ready to approve it for 1A. So that was people, healthcare workers, and people who were really high risk, right? She said, 400,000 people at that time, that was back in December, are dead now. And she was like, we can't afford not to get the vaccine. And that was the turning point really for me, because there are a lot of people who are worried about the long-term ramifications of getting the vaccine. Well, guess what? You might not live to see the long-term if you don't get the vaccine today. So it's a catch-22. And then one of the things, real quick, I wanted to touch on, Dr. Friend talked about the economic disparities, right? Basically, the fact that we don't have money to go to the hospital, and the fears of having medical bills and things like that. Again, I totally get that. Like, I was not born with the silver spoon. I'm straight up from Philly, okay, Philly girl. My husband's from PG County. We were not born, with spoons in our mouths, right? So we get that totally. And but the vaccine on the other side is free. That's the first thing. The vaccine's free. And secondly, the fact that we don't have resources is actually a reason why we should get the vaccine, because if we get sick, there's a strong possibility we don't have the resources to go to the hospital, or we don't have the time to stay home from work. We can't afford to. That's, to me, those are reasons why we should get the vaccine. I mean,
my biggest struggle, Andrea, is talking with some of my millennials, is that, like Marcy mentioned, they're on social media all the time, and that's where they're getting the information. And I actually talked to someone recently, and she said, I'm not going to get the shot because they're putting stuff into you, and you can take a magnet and put it on your arm. What kind of vaccine is that can attract a magnet? I'm like, where are you getting this from? And of course, it's Facebook.
Yes.
So we have to have more platforms like this to counteract what's going on social media.
I appreciate that. Thank you so much. Don't go anywhere. Dr. Kahana, if you could just give us a few stats. But then there are also a couple of questions in the chat. I saw someone say, and Roxana will give them to us, about, obviously she's concerned about getting the vaccine, but Willie is trying to figure out what the side effects are. I'm just based on what I remember.
So I thank you, Ms. Marcy Clark and Mr. Clark, I think. Appreciate you guys being such staunch supporters. Now, the vaccine has been developed, like I said, by people like me who worked on
People
viruses.
run-
No, I'm gonna run out like this. Cause that. So, let me go get my ice cream.
Hello.
I'm sorry. I'm so sorry. Wait a minute. I'm sorry. That's my 17-year-old. I'm like, why are you here? You should be
no
running
problem.
track. I'm sorry. Go ahead.
No
I'm on mute
problem.
now.
No, he should listen. Actually, you might want to get the
Well,
vaccine.
I have to tell you, he's vaccinated.
Oh.
Yes. And then just so you know, Marcy, he wants to go to Temple, but that's another conversation. Go ahead, doctor.
That's my alma mater. That's my alma mater.
Marcy, we'll talk later. Go.
Yes.
I'm sorry. Go, Dr. Kahan.
So, first of all, the vaccine was never developed by any government. Okay? It was developed by doctors like me and who've been working on viruses our whole entire lives. That's what we do. And eventually, when it came time for this pandemic, we had to all put our heads together and say, okay, well, how do we create a solution to this really terrible problem? And initially, we thought there'd be a drug. We thought, well, remdesivir, okay, monoclonal antibodies, okay. And then we went on to the steroids, okay. Well, that, nothing was really fabulous. And the vaccine people were running around with their little cell lines and testing it on animals and volunteers. And they said, okay, we're ready to go. So what do we do now? We had the vaccine. So their next line of testing was 1A, which was the healthcare workers. They said, okay, you guys, everybody line up. You guys are going to take one for the team and we're going to test this thing on you guys. And so I was hesitating myself in December 13 when it first came out that, oh my God, I have to be 1A. Why? But you take one for the team. And I'm so very glad I did because, the realities of COVID are such that you not only get sick at random, there's no real logic to it. It's not the young people, it's the old people, the ones with sickness and such. I mean, those old people with multiple chronic diseases are more likely to be in a ventilator bed. But a young person who gets it may also be on that ventilator bed. There's no real prediction. And then after that, sitting on that ventilator for a month or two, when you come out, you're likely to have this long haul COVID. You're likely to have lung effects. You're likely to have a fog sitting on your head. You're likely to have kidney disease. I mean, who wants that? If in your right minds you could do anything to prevent this terrible disease, you should do it. And one of the ways, of course, is to mask and to also take the vaccine. That is one of the ways. Now, side effects, I know somebody is talking about side effects, so I'm going to make sure I talk about them. So we at our office take care of Novavax, Moderna, and previously the Pfizer vaccine people after they get the vaccine. And so we see a lot of them. We see a whole slew of them go through our office because they've been vaccinated in the trial. And in the trial, some of them are getting higher doses of the vaccine, not the dose that is being given out to the community. So we are seeing these people come out healthy. Even when they are exposed to COVID, their disease duration is a day and a half. A day and a half. That's it. It's not like everyone else who hasn't been vaccinated, who's going to be sick for 10 days. It's a given. You're going to be sick for 10 days no matter what. Very few people don't have any symptoms from COVID. Very few people. Most of them have some symptom of the other, headache and loss of taste and smell, and it sits there forever. And it's pretty terrible. So if you were to consider the side effects, the big ones that have been talked about by media are with the clots. I think the clots had a lot of press from the Johnson & Johnson vaccine. People were just going nuts with that clots. Those clots are more likely to occur in reproductive age women. Those are people who get it. So it's women under the age of 50, likely women who are on birth control pills. And yes, there is a small likelihood you may get a clot. However, for that same young woman, there are 3 vaccines to choose from: Pfizer, Moderna, J&J. If you were a young woman and you said, okay, well, I don't want the J&J, all right, you still got 2. You got the Moderna, you got the Pfizer, right? And we have seen some arm swelling and a little pain. Some people are getting a little feverish and a little headache, but all those things are time limited. They last 1 to 2 days and they go away. Pretty much like getting an influenza vaccine, which also gives me the thing. You are not being injected with the COVID. Okay, remember that. You are being injected by a protein that produces the antibody to the COVID. So first of all, you're not being injected with the COVID. Secondly, there's no magnetic nothing in it. There's no DNA stuff in it. Okay, there's nothing. It's a clean little vaccine. It doesn't have too many ingredients, all three of them. The least ingredients are in the J&J vaccine. The newer one that's coming, Novavax, is considered to be a traditional vaccine. So it's going to be a subunit protein, which will help you create the antibodies to it. Somebody wants me to talk to the pathogenic protein. So I'm not sure I understand that question. You may want to elaborate for me a little bit on what you mean by pathogenic protein.
And here's what I know, you if they can do that, but somebody else also asked if why should they get the vaccine if they plan to wear a mask anyway?
Yeah, that's a good one. Okay, so a mask, is not a perfect protection. The mask has to be a certain thickness. It has to be stuck to your face for a certain duration of time. And I don't know if you've worn these N95 masks. It leaves a mark on your face, and you can't breathe after some time. And you just have to take it off. To eat, you have to take it off. To drink something, you have to take it off. Your nose runs, you have to take it off. Right? So there are multiple occasions when you're going to take off your mask. I'm telling you this from a person who's had to wear this terrible mask. And those masks are not perfect ever, because you may not have stuck it down on your nose. You may not have stuck it down here. So there's this COVID running around. Now we're going out. We're going out of our houses. We're going to the grocery. We're going to school. We're going to the gym. And people are just ripping off masks in the gym because they just can't breathe in those while they're huffing and puffing, lifting big 300-pound things. So you got to consider, you have to protect yourself. I mean, you can't be responsible for the rest of the world, but to protect yourself, the one thing is a mask. And yes, you can use a mask. You can try to distance, but these days with the relaxed restrictions, people are not sitting 6 feet apart. They're not even 3 feet apart. They're right in your face. So if you're in the company of someone who's got COVID and you're in their face for 15 minutes, your little mask is leaking, what's the chance you're going to get it? It's a very infectious virus. If you had the vaccine and the mask, then these variants are probably not going to touch you. And variants happen because these cells, they divide, and they divide. A little bit of DNA gets tossed around, and that's a variant. And how easily can that happen? It is really easy for a virus to mutate. So I would encourage you to consider it. There is a lot of confidence building that we want to do. There's a lot of apathy that we want to dispel. We want to come out to you to get you out of your complacency. Yeah, like everyone else is going to get it, so I don't need to. Well, you still need to, because those people who are vaccinated are probably seeing people who are not vaccinated and carrying that COVID around in their nasal passages or somewhere there. So these are real scary things. These are real scary things. And like you've heard from multiple people, I'm sure you heard from the Clarks today about having the COVID disease. I'm sure there are people in your community who've had it, because I know I've been tracking numbers all over West Baltimore, and I can see that they're just about sitting on top of each other. If you visited somebody who slept over, well, if you brought the COVID in or somebody had it, you're going to get it, right? One way or the other. So I guess I'm going to stop there.
No, you don't. People are intrigued, and I think it's important information. A couple of things that that somebody asked about the booster shot, right? So I'll let you speak to that. Data in DC, if you have any data about, what that looks like in DC, and then, what kinds of things are being done about vaccine. We don't call it hesitancy, but about vaccine deliberation. Like, what specifically will University of Maryland, what are they trying to do about vaccine, especially in those communities?
Mm-hmm. Yeah, that's a good one. So thank you so much. I'll start there. So I actually have two grants. One is a very big federal grant, which is to give $20 to everybody who wants to get a vaccine and give you transportation. And and what we've also done through our grant is to fund the Community Engagement Center on Poppleton. And they are going to have a clinic where vaccine will be delivered, and you'll get the transportation and your $20, which is supposed to be a post-vaccine care package. It's not a gift card. It's supposed to be so you can get your Tylenol, your Gatorade, and heating pad if you want it, things like that. That's what it's for. And we'd like you to take it. Please take it, because if you need to buy all these things because you got the vaccine and you're getting help, use it. But the other questions that you had around booster, I'll speak to that for just a second and tell you that it is highly probable right now that you will have some guidance on a booster. That guidance is going to be based on how long your immunity persists after you've gotten the initial 2-dose vaccine, or 1 dose if you got the J&J. And we don't have the answer yet, because the people who were the first to get the vaccine in clinical trials have been followed for about 8 months or thereabouts. I am going to be on a Monday morning federal briefing call, from which I'll be getting some additional information as they learn more. But as of now, we're thinking there will be a booster in the fall, but we're not sure at all about that yet. In terms of additional vaccines that are in the pipeline, Novavax is the next vaccine that's coming out. And there has been a paper in the New England Journal today that has described its success. And that vaccine is very much like a traditional vaccine. It's like getting like we get the tetanus shot and the measles shot and this and that, those kinds of vaccines. So it's going to be along the lines of that. And I think I do want to speak to the person who's asking me this pathogenic question, because I think it's a real question for her. So I'm just going to take a minute to address her need. So to tell you how I know vaccines is through having worked really closely with the HPV vaccine when it was being developed. And in HPV, we had the same question. In every vaccine, the question is the same. Which protein shall we pick to which we create the vaccine? That's the question. When you start to look at a virus and you go, well, I'm going to create this vaccine here, you always look at the structure of the vaccine and you go, okay, which part of this virus am I going to select? That's going to be my antigen to create the antibodies in the patient. Okay. So in every vaccine, there is a piece of that protein that we inject, which then leads you to create the antibodies yourself, because it's your own immunity that works in a vaccine, right? So in the coronavirus, it's the spike protein. It's because the corona is shaped kind of like a circle, and it has these little proteins which sit on the top, which are kind of like little spikes, like, little horns. And those little spiky proteins are the ones that are being used. In the mRNA, they use a piece of protein to go into your cell. They don't inject you with the spike. They inject you with that little other protein, which goes into your cell and tells it to create a antibody to the spike protein. In the J&J vaccine, they use another virus, a piece of another virus, adenovirus, which goes into the cell and does the same thing. In this new Novavax that's coming up, they're going to use a teeny piece of that spike protein. It's not the whole spike. It's just a teeny piece of it, which goes into the cell and teaches it how to create the antibodies, which then protect you. So that's the concept of a vaccine. That's why you use vaccines, because they go into your cell and stimulate you to create the antibodies to whichever virus it is that you're working on.
It looks like Miss Marcy has a comment, and then we have 2 more in the chat.
Yeah, just a quick moment. I wanted to get a feedback from Dr. Khanna. Are there any studies about the antibodies and how long they last? The reason that I'm asking is my antibody test came back 3 times higher than normal, probably indicative of how sick I was. Marcy's barely hit the mark. So I'm curious on how long, is that a benefit to have these antibodies, and how long are they generally lasting?
That's a wonderful question, to which I don't know that I have a wonderful answer for you, but I'm going to try. So people like you are being followed really up close. They're being tested monthly, and they're being followed to see how long will natural immunity, because what you have is natural immunity plus the vaccine. So they're going to follow you to see how long it will last. And every vaccine is the same. For example, you get the influenza vaccine every year because in influenza, you develop the immunity and it stays up for a while and then goes push down, which is why come fall, you need another one. So in Corona, we're not sure because it hasn't quite been a year yet. It's not quite a year yet. So we have to wait to see, will it last a year? Will it last 2 years? Will it last 6 months? Well, no, we're past 6 months. So we have about 8 months of good data. But past that, we're waiting to see, okay, is it going to continue? Is it going to continue? Yes or no? So I think the answers will be available around, we're thinking maybe September. That's when the first question about booster will start to be answered. Okay, yeah, we're seeing a decline now, and probably at this level, this is where we're going to start to see infection. So we should now vaccinate at 9 months or 10 months or whichever that's going to be. I don't know yet exactly where that's going to end up.
So really quickly, Dr. Khanna, I have a question here that's it seemed like it's kind of multifold. If a female under 50 does not want the mRNA vaccine, why hasn't J&J told the real consequences for menstruating women? And what are the similar characteristics to those who had clots other than birth control pills? And if a 14-year-old should consider getting the J&J vaccine?
Oh, yeah. Well, thank you. That last question is easy because a 14-year-old cannot get the J&J because they're not approved. So the 14-year-old is going to be offered the Pfizer right now. And I think Moderna is coming along, but it hasn't gotten approval yet for the 14-year-old. Now, as far as the under 50s goes, I don't think J&J expected this complication to occur. None of us did. But in women, as you may know, women are more prone to clots anyway. We get pregnant, we get clots. We take the birth control, we get clots. So we're just clot prone. And this vaccine actually had, when the first 6 clots occurred, I had told my office, hold on the ladies, especially the young ladies. After 50, you are less likely because your levels of estrogen start to decline. They basically naturally decline. So after that, your risk for clots naturally goes down. So the J&J had an unfortunate, episode with those clots. And I think once we figured out, okay, it's these women, then we were all able to tell the ladies, because please don't just stay away from the J&J. We'll give you anything else. You want the Pfizer, you get that. You want Moderna, we'll give you that. But until they clarify, they figure it out, maybe they retweak their vaccine. Until then, let's just hold on that. Because we know women get clots. They're just getting. It's just a nightmare. If you go to the ICUs and look around to see who are the people with clots, I can guarantee you it's going to be the ladies all over there. Maybe one little guy, but they're all going to be ladies. So it's just the nature of being a woman with estrogen. And I think the J&J unfortunately took advantage of us and just made those ladies get clots. So just hang on to that idea, because I'm sure there'll be more information coming on. As of now, we know the association, but not the causation. They're different. The association is when you take the vaccine, you get the clot. The causation is, I know what it is in the vaccine that made you get a clot. So I don't know that yet. Well, as soon as I figure that out, I'll come tell you.
Thank you, Dr. Khanna. So you touched on this a little bit before. Is there any truth that the vaccine is only good for 6 months of immunity after the first or second dose? You talked about not having enough information yet, but I don't know if you wanted to add something.
Not really. I think we have about 8 months of data that it's good for 8, and we are waiting on more. And you want good data, you don't just want the garbage. So let's just give these guys a little bit more time. And as information comes out, we will bring it to you.
So in wrapping up, our last question, how do you know the current vaccines are effective against the new variants? You really haven't talked about that yet. And the CDC is saying it's effective, but those variants were not out yet. So how is the data of efficacy being obtained?
So some of the data, thank you for that question too. Some of that data is available on the CDC website, as you saw. Some of my information, and I am allowed to share this because we're part of that trial, Novavax and the Moderna and stuff. So we are seeing the patients when they're exposed to COVID. Like I had a patient who had been to Uganda. came back and became positive for COVID with one of those variants. And she was sick she wasn't even sick. She just had barely like a little stuffiness for a day and a half. So that tells me that vaccine worked, right? Because had she got one of those variants, she'd have been in the ICU normally, but she wasn't. So that makes me think that these variants are likely to respond. And also remember, these vaccines are not specific to one type of virus. It's specific to that protein. So unless that variant has a different spike protein, which it doesn't yet, it will be effective, which is why they can say that with reasonable certainty that this is probably going to work.
So I just wanted to thank everyone for coming out tonight. Thank you, Dr. Khanna. Thank you, Mr. and Mrs. Clark. Do you guys want to give any final comments? I know that I will say that Andrea and I both took the vaccine. We both worked out every day during the pandemic, and I got sick I kind of felt sick the first shot, really felt sick a couple of days the second shot. She really didn't feel anything. So even between us who are, I think, healthy, we both had different responses, but I still felt okay afterwards, but just for people to keep that in mind as well. So I'll let you go, Dr. Khanna, and then I'll let the Clarks go.
I just want to thank everybody for inviting me, for listening to me, go on and on. Sometimes people don't want to listen to me, but you all did.
I like listening to you. I thought you were good.
We needed your information. We appreciate it.
Mm-hmm.
Thank you.
And our
Thank you.
superstar couple.
Thank you for having us. This was really informational for us as well. But I just wanted to just say this morning, I actually saw on the news 99% of recently hospitalized and deaths actually occurred within the unvaccinated population. Yeah. There's just more and more information that just comes out to support getting a vaccine. Just like Roxana said, yes, there are definitely side effects. We got sick, we had like flu-like symptoms for about 24, 48 hours when we got the vaccines. That's to be expected, right? It means that it works. Anything that is man-made, whether it's the most simplest drug, Tylenol or Advil or whatever, is going to have side effects. Is that right, Dr. Khanna? It's going to have side effect, right? But the question is whether or not the risks outweigh the benefits, or vice versa, whether or not the benefits outweigh the risks, right? And there has been nothing that shows any substantial information regarding any major side effects or deaths with the vaccines. However, we know that COVID kills, right? Because we're 600,000 plus now in the hole, right?
And counting.
And counting, right? And at this point, all of us know somebody who's been affected by COVID one way or another. So we know that it's real. We're not asking if it's real or not. And so, I think it was Dr. Khanna who just talked about, masks are not 100%. Nothing's 100%, but what you want to do is definitely just arm yourself with the best shield that you possibly can have. And right now, that's the vaccine. And so again, I just can't stress enough, just if you're on the fence, just pray on it, talk to your physician and make an informed decision. But I definitely think from the heart, from our personal experience, that you're better off with than without.
Amen.
So first of all, we can't thank, we've got, people in the chat saying there's got to be a part 2. This was great. Thank you for the information. And thank you all for your transparency, your honesty, and thank you for your testimony, right? That has been, again, the lump is gone now because I was talking to my kid, but just as I think about what could have happened, that could have looked very different. So I'm grateful that you have shared that. I think it's important. And I think Dr. Khanna said it, we've all been impacted. The best man at our wedding just died from COVID. 50 years old. I'm like, how is that possible? And so, just kind of figuring all of that out. So again, we thank everybody. We know that people feel that we are oversaturating this space, but you know, there's a lot at stake. And so again, thank you. Roxana, I'm not sure if there's a survey at the end, so I'll let you close it out, but
There
appreciate
is a
everyone.
survey. Yes, there is a survey at the end. We will replay this on Facebook and YouTube. If you saw my comments in the chat, I got kicked out of Facebook Live, so I will share that. And also, we will have a few more town halls, Mind Health Shop talks about this and why, because we've heard worse than the shot having metal in it. We've heard 5G has something to do with it. And it meant a lot to us to make sure people got good information from people that look like them, that's working in the community and that care about them, which is everyone that's here on the panel. So we just want to thank you for joining us. And please fill out the survey so that we can have doctors like Dr. Khanna and couples like the Clarks come back and give this great information. Thank you guys for joining us tonight. And so the survey will come out right when we close out the town hall.
Yes, and then the Clarks just put a shameless plug in about the book. But it is
Oh
worth
yeah, I put,
So it is-
no,
it
I
is
put
worth getting.
trainedwife.com. I put
Yes,
You
that's
didnn
right.
see me hitting her, put it in.
I know.
Yeah, I know, I
Right.
love it. I absolutely love it. We will push it, don't worry. I think it may even go out in our newsletter. So just know, I'm gonna reach out to you about Temple anyway.
Yeah, for sure. Thanks for having us. This was great.
This was great. We
Thank you
appreciate it.
so much. We
you, guys.
appreciate it. And thank you.
Yes.
It's such a blessing to see you. I'm like, oh my God, she was on television. And Roxana said, I got it. I said, I know, I remember the story. So thank you
Roxana was
again.
on it.
She
Thanks,
always
Roxana.
is. She is always is. Thanks, guys.
Thank
Thanks,
you.
Rob.
Roxana,
Have
they
a
didn't
good
show the
night.
good side of me rolling me out. You know, I just want to replay that. Just make sure you don't, tell people.
Well, we see your good side right now, so
Yes,
that's good.
you look
I
very
appreciate it.
healthy, prosperous. We're glad that you're okay.
Oh my
I'm
God.
eating everything in sight, let me tell you.
Okay, look, doughboy.
Exactly.
I love it. I love it. Well, you guys take care. We'll be in touch, and I know Rox will. But again, thank you so much for everything.
Tell your son I said, go Owls.
Oh Lord, here we go. He got a hat. I'm like, dude, you don't go to Temple. He said, not yet. He is a rising senior. He runs track. So we went to Temple during the pandemic, but the only place we just walked around the campus, and I bought all this stuff from the bookstore. I'm like, brother.
Yeah.
And he said, I'm